Can hand sanitizer stop flu cross-contamination? Imagine you're out and about, and you want to protect yourself from catching the flu. You might reach for hand sanitizer, but does it really stop the virus from spreading? Hand sanitizer, especially those with at least 70% ethyl alcohol, can help reduce the amount of influenza virus on your hands. It works by disrupting the virus's outer layer, making it inactive. When used correctly, covering all parts of your hands and rubbing for about 20 seconds, it can lower the risk of spreading the flu. But it's important to remember that hand sanitizer isn't a magic shield. Influenza viruses are often hidden inside mucus droplets, which act like a protective gel. This mucus can shield the virus from alcohol, meaning the sanitizer might not fully inactivate all the virus particles, especially if they are embedded in thick mucus. Usually, hand sanitizer needs to stay in contact with the virus for several minutes to be fully effective, which is longer than typical use. Since most people don't hold their hands in sanitizer that long, some viruses can survive. In comparison, washing hands with soap and water is more effective at removing viruses and mucus from the skin. Soap breaks down the virus's outer shell and washes away mucus, often within about 30 seconds. This physical removal makes soap and water a better choice for cleaning hands contaminated with mucus or after coughing and sneezing. Research shows mixed results about how much hand hygiene alone can reduce flu infections. Some studies suggest that using hand sanitizer, along with good respiratory hygiene, can lower the chances of catching the flu, especially in settings like schools. Other research indicates that hand sanitizer alone may not significantly cut flu transmission. It's clear that hand hygiene is just one part of a broader prevention plan. In everyday life, hand sanitizer is a handy tool, especially when soap and water are not nearby. It's most effective when your hands are not visibly dirty or covered in mucus. If your hands are contaminated with mucus after coughing or sneezing, washing with soap and water is the better choice. To really protect yourself from the flu, combine good hand hygiene with other measures. Regular hand washing, using hand sanitizer when needed, getting the flu vaccine, practicing respiratory etiquette like covering your mouth when coughing, and avoiding close contact with sick people all work together. In summary, hand sanitizer can help reduce flu viruses on your hands and lower the chance of spreading the flu, but it cannot fully prevent cross-contamination, especially when mucus is involved. The most effective approach is to use hand washing when possible, supplement with hand sanitizer, and follow other health guidelines. Always remember to consult healthcare professionals for personalized advice and stay informed with trusted health sources.